Surgeryandmedicine.com. Your med school in your pocket.
Morning, Mr. Clements. My name is Miss Scannell. I'm going to examine your hips, you know, because that's why you've come here. What I want you to do first of all is just stand up and here.
The patient standing, inspect from the front for pelvic tilt or any external rotational deformity. From the side, look for any flexion deformity, increase in lumbar lordosis, quadriceps wasting or scars. From behind, look for pelvic tilt, scoliosis or muscle wasting.
What I want to do now is test some power in your hips. I'm going to hold hands with you.
Okay.
If I take you like that.
Yep.
Okay. And I want you just to watch what I'm going to do. I'm going to ask you to stand on one leg on its own and then the other leg on its own.
Weakness in the contralateral hip abductors causes the pelvis to tilt downwards in a positive Trendelenburg sign.
That's great. Okay. What I'd like you to do now is just walk backwards and forwards for me, just up to the table and back.
A painful gait would be known as an antalgic gait. If the pelvis dropped to either side, we'd call that a Trendelenburg gait.
Okay, get you to hop up on the couch for me now, please.
You should ensure that the patient is lying flat for the examination of the hip. Once we've got the patient in the correct position, we can then go on to examine the hips again and look for all the signs that we look for when the patient was standing.
From the end of the bed, I'm just going to check that your legs are the same length, which they are. Just going to feel on the side here now, just for tenderness, tell me if it's sore or not.
That's fine.
And the same on the other side. What I'm going to do now is test the range of movement of both of your hips. I'm going to start with the right one because it's closest. Put my hand underneath your spine, like that. What I want you to do is just follow me up with your leg by bending your knee and therefore your hip.
A hand under the spine ensures that the lumbar lordosis has been eliminated.
Just going to check rotation now. Come down with me again. You're going to do exactly the same on the other side.
Okay.
So if you bend up your knee, there you go. Just going to rotate that around. That's fine. What you're going to do now is move you out to the side. Start with this leg. And I'm going to do the right leg. Okay, have a seat, swing your legs round again, sit down there again.
To finish up your examination, thank the patient, ask them to get dressed and tell them what you found. There is an alternative method for examining internal and external rotation, which is useful in patients that experience pain on flexing the hip. We'll go on to look at this method now.
Okay, I'm just going to test the range of movement. What I want you to do is bend up your right knee and therefore your hip and follow my hand up. Now if that was very painful and you saw the patient wincing, you should not now test rotation with the hip flexed up. You should bring the hip down like that and then just gently roll the hip inwards and then outwards, just like that, because that's much more comfortable for the patient.